Lewato programme yu bore la buñ leen di isil alxamis bu nekk si GRTS dama ne ànd leen nag Linguère GRTS mu isil leen làmba yi nga xam ne moom ngeen soxla dina fekki nag borekat yi si seen tàggatukaay yaram yi waaye tamit dina waxtaan ak ñi nga xam ne ñoo xam làmbi démba ak làmbi tey programme bi nag dinañ leen ko isil alxamis bu nekk si juróom-ñetti waxtu yees genn wàll si ngoon bi si juróom-ñetti waxtu pour be jàppale ki nga xam ne mooy ndugi war yoo bi galgal na ko daaneel na ko ndaw Linguère xaritu mbër yi yaa daan maa daan moo daan coow li bëri na xarale yu bees dekkil cosaan de waa dongo
woot bi amut xanaa yow da nga dof
fii la
dafa over am sax.
Find out every Monday 10:30 p.m. on GRTS.
I am Binta Hydra.
I am Tijan Janet.
I love callers Macomium.
It's because of the free credit I have.
$3 for every minute of international call I receive and $1 for every minute of local call I receive.
I can use it for text, I can use it to call, and even free internet.
So, call me on my Comio.
Hello viewers, it's the Fatu Show. It's always nice to be back. Last Saturday was Rhythmic Vibrations at the Caribou Hotel. It was amazing. The Fatu Show, the entire team would like to say a big congratulations to the Balafang team for putting up such a program. The turnout was really good and would love to see more of this sometime soon in the future. In the studio today, we're going to talk about something very interesting, something that affects us all, the healthcare system, but specifically the hospital, some of the things that the patients are concerned about when they go to the hospital. With me, I have Mr. Modunjai, Director of Health Promotion and Education. And I also have Mr. Dauda Sise, Director of Planning and Information. They're both from the Ministry of Health and Social Welfare. Welcome to the Fatu Show, gentlemen.
Thank you.
Thank you.
How are you today?
We are fine.
When I think of the health sector, I think about quality and poverty. Now, what has the health sector tried to do to bridge the gap between the poor and the quality of service that they receive?
We have a new policy which was just revised and approved by the Executive Cabinet, which we are now going to put into operation, and it has a mission, vision, goals and objectives as well as targets. If you look at the vision and mission of this policy, is very much geared towards providing quality, equitable healthcare to the citizenry, which of course underscores what you've just mentioned. So that's the policy direction. actually. We are concerned about quality. We are also concerned about equity in the way we provide health services.
Ms. Njai, you're Director of Promotion, Health Promotion and Education. What are some of the things that you're doing to make sure that the public are very much aware about health, their environment, basic things that people need to know?
Equity here means fair distribution of health services. And I think we're looking at equity, and we're also looking at equality, that everybody should have equal access. And our health service is fairly distributed. If you look at the primary healthcare system, people don't walk more than 5 kilometers without getting access to healthcare service. That means we've really assured the issue of equity. So everybody have access to health services. It depends on wherever you are, but we have access to the access is there, and also the equal distribution and all fairness in the distribution is also there. When you come to the health promotion, basically our role is to create awareness, is to inform people, educate, so that people can be aware of the benefits we are really offering in our facilities. And in that regard, we want to create, we want to inform the people that we are offering A, B, and C services, so that people can come for those services. And then we're really doing a lot of work in that area. The Ministry of Health have really worked in that area to inform people, to educate people, so that people can know where they need to go for services. Nowadays, when you go to the health center, the moment people are just sick, even in the rural, remote communities, the moment they are sick, they just think of going to the next level is to go to the primary health care worker, which is at the grassroots level. And if that person cannot manage, the next level is to refer to the minor health center. If they cannot also manage, they also refer to the major health center. And it goes to the hospital.
I mean, with regards to accessibility, which you were talking about, it's there. We have the structures, we have people in the hospitals, we have nurses and doctors. But then patients are not very comfortable with some of the services or the treatment that they get when you go to the hospital. Healthcare
services, like for example, you can tell people we are offering A, B, and C. But also depends on the people, when do they need to go and seek for those services. If they don't go at the right time to seek for those services and they wait, and when it is late, there are certain times it's difficult for them to get those services on time. Like if you know you are sick, you have to take the appropriate channel. Like we know there is an outpatient department where people start up with. And then the moment they see you and outpatient, maybe perhaps they've seen that you are not moving or you are not improving well, then there you are referred. Maybe if there's a surgical problem, if it is maybe a chronic problem, it could be whatever. And they refer you to that level. And I think what people need to understand is when you are given an information to go to a health facility or to a hospital, to be able to see Dr. X, Y, and Z, for example. Yeah, people are so, like for example, the moment they are in the hospital, some people I would say, they're just confused when they're in the setup. They don't know where to go. They go to the wrong places. And when they are asked to go to another level, they become easily agitated.
I think I have to come in at this stage. The health service delivery system in this country is fairly well distributed. We have a 3-tier health system, from the primary, secondary, and you have the tertiary hospitals. We have almost about 556 primary health care posts where you can access services 24 hours from our village health workers and our traditional birth attendants who have been delivering women in this country exceptionally well. And their services have been very remarkable. From that level, because the health system is in such a way that it's all interconnected and interlinked, from the bottom to the highest level. From the primary, you move to the secondary level. And the secondary level, you have major and minor health centers. For the major health facilities, you have almost about 7 of them, which provide a range of services. And, you know, as you rise up, you know, the services become more complex. Like, for instance, at the primary level, you expect to have basic minimum services like major ailments, major complaint, headaches, fevers could be treated. But once you have injuries, fractures, accidents, something beyond that level, you are automatically referred to the minor health centers. They have the capacity to deal with that, the doctors, the equipment, you know, and all the issues. And then